while I do have this presentation about mental health and church and faith, I also invite you to ask questions about mental health in general, or what does this mean during this pandemic. Typically, this presentation is about an hour long. So if you've been to one of the other Faithful Family trainings, you have kind of seen this presentation. Hope I can spice it up a little bit. But what I want to do today that's a little different is leave a lot of the time, the majority of the time, for questions. So like I said, these can be about mental health, about faith and mental health, whatever you think will be helpful for you as you think about working with the communities that you will work through both in this time and after. So I'm happy to answer any of those questions the best way I can. Okay, so I will get started, and I'm going to share my screen. All right, so to kind of give you an introduction, the majority of there are a couple of umbrellas that I put my work under, and faith and mental health is a really big, broad umbrella. Within that umbrella, I focus a lot specifically on African-American communities and what we call the Black church. And so while some of this information is more broad, some of it is very much more specific to those communities for a couple of reasons. Because a lot of those communities tend to be underserved. And as you will see as we talk through the presentation, faith and religious communities can be such a huge part of the culture in both health and mental health. And so we saw an area that needed kind of attending to and understanding. And so that's where a lot of my work focuses. So we'll get started, and I'll try to keep track of my time. So like I said, I can leave at least about 30 minutes, hopefully, for questions, okay? All right, so I always like to say thank you to Faithful Families for having me. It's always good to be here. I think this is just a perfect intersection of my interests. And so I'm just really happy to share with you all. So typically I spend a little bit of time talking about my background, but Annie read my bio, so I don't want to prolong that. I do want to say, though, I think it's very important that we are aware, and when we come to this work, that we're aware of our experiences, even our biases, even our thoughts, what we believe, what we don't believe, because that can very much shape how we approach this work. And so I'm very honest about the fact that I grew up in church. I was what you call a church girl. And it has shaped and been kind of the crux of a lot of my life experiences. And so that really is the foundation of kind of how I think about this work. But when I became a counselor, I was challenged to think outside of what I may have been always taught in my life, or I was challenged to see life from another person's perspective. So even if you don't directly identify as someone, a person of faith, or a religious person, or a spiritual person, or maybe the group that you're working with, they have a different orientation than you do, a different religious orientation, it's very important that you are aware of kind of how you come to the work that you do, and being open-minded to understand someone else's point of view. So typically, if we were in a traditional setting, I would kind of ask what brings you here and what do you hope to gain? But I invite you, even as you're taking notes, to just think about really what brings you here. Did you have to come today? Did you want to come today? Is there a particular question that you had that you're hoping that I will answer? If you can, if you'll write that down so that when we have the Q&A, you won't forget those questions. And if there's something in particular that you're hoping to gain from our conversation, I really hope that you kind of keep that in the back of your mind so that I don't get to it in the slides, then I'll be able to answer in the Q&A part. So this is just a brief overview, but like I said, I really want this to be a time where we're able to dialogue and converse. And to be very honest, as much as an introvert I am, I think I've reached the end of my introvertedness. And so I'm really looking forward to the opportunity to be able to kind of talk to you all about some of this stuff. So I'm hoping that you have a lot of questions for me. Whenever I do these presentations, I always think about the who, what, when, where, and why. And I invite you to think about that for the people that you will be working with, for the populations that you serve. Who are you working with? What are you doing? When are you doing it, right? Where are you doing it? And why are you doing it? And so I think about this conversation it's always so different because there's always something else going on in the world. And so when I was reading the news and it listed the essential businesses that will still be open, one of the essential businesses was faith communities. And so I thought that was so telling because I think it really speaks to the importance and the need for people to feel this connection to community. So let's shift a little bit to mental health. I can't see the chat box, but if you could just put in the chat box, if you're able to access it, a couple of things that come to mind when you hear or when you think about mental health.
And I can read those out loud if you'd like me to.
Yes, please. Thank you.
Depression, PTSD, stress, stereotypes, well-being, stigma, yoga, self-care, OCD, holism, anxiety, well-being, meditation, childhood trauma, wellness, anxiety, verbal violence, invisible to others, impact, isolation, empathy.
Okay. I love those kind of descriptors because what came to mind for me when I was reading them was the breadth of kind of responses that stood out, both from a more, let's just say, like self-care side, like with the yoga, the meditation, but also we got into the idea of what does it mean to have a diagnosis, so OCD, things like that. So I want you to think about, and we're not in a room, so I can't see you, but to think about what came to mind first for you, and to think about how that may shape how you work with people and how you do this work. So if the first thing that came to mind for you maybe was a mental illness or a diagnosis, that's not necessarily wrong, but it does give you some information about kind of how you come to this work. Or if the first thing that came to your mind was, let's just say, walking outside or self-care, then that also gives you some information about how you come to this work and kind of what your approach may be with working with individuals. So if there is a diagnosis there, are you able to see it? How do you respond to it? That type of thing. One of the important words that I heard that comes up all the time is stigma. And I also like the word invisibility because we don't often see mental health diagnoses. And even before something gets to a diagnosis, or if we don't have a diagnosis, we don't always see when people are struggling. And so I think that's important to be able to acknowledge that a lot of this work will will be more less apparent than some of the other work that you will be doing, and people may not be as readily willing to share with you. So a lot of you may work with congregations who are doing work on diabetes or who are doing work on heart disease, and that's kind of okay to talk about. So people have these campaigns about that, but you may not see the willingness to talk out loud about depression or anxiety, or to do a whole kind of health fair on mental health like you would a diabetes or a health disease. I go over these facts because I think it's very important to think about the systems in which we operate in. And so I borrow some language from public health when they talk about social determinants of health. And I like this definition because it says, social determinants of health are the conditions in the social environment in which people are born, live, work, and play that affect a wide range of health functioning and outcome and risk. And so I put these quick stats up here about African Americans in general because I think it's very important not to perpetuate stereotypes or to be negative or biased thinking, but to have an kind of really under full understanding of the systems that are operating, and that when people have to live and work with them and within them. And so African Americans have twice the poverty rates, twice the unemployment rates, higher homicide rates, higher infant mortality rates. And if you've been paying attention to the news, you've probably seen a lot about the maternal and infant mortality rates among Black women being very disproportionate at this time. And I was reading a study the other day and said the rates are most disproportionate among Black women who have PhDs. And so that's very interesting to me. Black men have the lowest life expectancy of any race, gender, and there are also physical health issues. And so you may be thinking, what does this all have to do with this conversation? And health and social inequities are persistent. They still persist. And I think that it's a cycle. And so I don't think it's a coincidence that Black men are not as likely to go seek a counselor, and they also have higher or they have lower life expectancy rates, right? I don't think it is a coincidence when we don't seek help for our mental health, our emotions, that we experience somatic symptoms, psychosomatic symptoms. I don't think it's a coincidence. You know, what happens when you are young and you have been exposed to violence and homicide at a very young age, that has to take a toll on your mental health. And so I want us to get an understanding of what mental health is. And mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with normal stresses of life, can work productively, and make a contribution to his or her own community. And so we all have mental health. So it's not like this person has mental health or that person has mental health. Mental illness is a condition or a diagnosis that may affect a person's ability to function. So that is your OCD, that is your bipolar disorder, that's your depression, that's your anxiety. And so while we all may not have a mental illness, we all have mental health. Some common mental health diagnoses are depression, anxiety. Eating disorders is one that we don't talk about a lot, and one I think particularly in Black communities that's not focused on a lot, because we have this idea that it happens more to white women, and that's just not true. And so we need to pay attention to that. Post-traumatic stress disorder, someone mentioned that in the chat box, bipolar disorder, and schizophrenia. So let's talk a little bit about the numbers, and then I want to get into some of the more stuff about religion and spirituality. But I think it's important that we truly understand the impact and the breadth of impact that this has. And so depression is the leading cause of disability around the world. It's affecting about 300 million people, according to the World Health Organization. In fact, in the US, about 7% were affected by depression this past year. And as we talked, there are a variety of things that can lead to depression. There's genetics, biology things, life circumstances, medical condition, drugs, alcohol use, and abuse. Anxiety is a state in which someone may be worried about life situations, relationships, their health, and this anxiety can cause sleep disturbances, like psychosomatic symptoms. So if you ever been to the doctor and you had like really bad stomach pains or stomach issues and the doctor can't really find a biological reason, a lot of times though that may be anxiety. And because anxiety can manifest both emotionally and physically. And women are more likely to be diagnosed with an anxiety disorder compared to men. So I'd like to invite you all to think about mental health as a continuum, not something you have or you don't have, but a true continuum of, at any point in time, I or someone else may be at any given point on this continuum. So if you think about your own self, there are days where you like, you know, I walked today, I ate really well, life is good. I may be on the plus end of the continuum, right? Then there are days when you're like, I don't feel like getting out of bed. Maybe something happened, maybe I lost a loved one, and I'm not as far on that continuum as I was. And so there's fluidity in that. And so as you're working with people, be mindful that where they were one day may not be where they are the next. And that life circumstances can really put us at different places on the continuum. So even the other day I was thinking, like after day 5, I think, of being in the house, I was like, it was really starting to get to me. And I was like, what do I need to do to make sure that in this time that I'm here, I wasn't feeling well, all this stuff was going on, that I myself don't kind of move further along the continuum than I would like to move. So it's just something to be mindful of. Some quick stats. I see the chat box lighting up. So Annie, are we going to hold those questions to the end, or do you want me to answer them now?
It's up to you. I've been putting them kind of in a document so that I can read them out loud, but that's totally up to you.
Okay, well, we can go about a few more minutes and then I'll start answering questions. So these are a couple of infographics just to help you kind of get a quick snapshot of what mental illness looks like, or mental health looks like, particularly in African American communities. About 16% of African Americans had a diagnosable mental illness in the past year. What's difficult about these stats is that African Americans don't seek help at the rates of other populations. And so we're not able to get as accurate of a count So a lot of these numbers are likely higher. We just don't know. One of the statistics that always stands out to me is African Americans are 20% more likely to experience serious mental health issues, but are about half as likely to get help. And so I think that's where our work lies. And I don't, when I'm talking to counselors or when I'm talking to community groups, I'm always like, this is not a blame game. We have to ask ourselves why people are not seeking out our services, because we have to do some reflection and say, are we accessible? Do people want to see us? Do they trust us? What is the history like? So I think it's important that as you are providing services, if people are apprehensive about sharing something with you, it's really a moment for you to do some self-reflection and see what you can do to make your community agency, your group more accessible, more approachable, and more trustworthy. And that may mean you connect with a community stakeholder, and we'll talk a little bit about that, particularly when it comes to pastors. But it may mean that you have to do a little bit of work outside of your comfort zone. So this is just some stats. I think I ran over them mostly. I do want to highlight that for mental health issues, African Americans tend to seek emergency rooms more often than they do more traditional outpatient services, which in itself kind of create some issues, because by the time they get to the emergency rooms, the symptoms are so severe that they're often misdiagnosed. So whereas something may really be anxiety or depression, is diagnosed with schizophrenia by the time you get to the emergency room. So that's just something to be mindful of. So what happens when mental health goes untreated? And this is just in general, there are huge financial implications. You know, if someone is not able to show up for work, it really affects people's businesses and their bottom line. Hospitalization, chronic medical conditions, shorter lifespan, and then we know suicide. And I think suicide is really important, particularly as we talk about Black boys, because it's become increasingly, the rates of suicide are rising at alarming rates within African American boys. And that's something that I think we have to address, and we have to learn how to say the word, and we have to learn how to not be afraid if someone is thinking about hurting themselves, to get them the help that they need. So why is religion and spirituality an important part of this conversation? Well, anytime I do the stats or the research on this, as a group, African Americans identify as more religious than any other racial group in the United States. And we can parse out what religion and spirituality means, you know, religion being more group-oriented, spirituality being more individual in nature. For this particular presentation, I just kind of use the words interchangeably. 67% of African Americans identify as Protestant Christian, and they have more frequent attendance at religious services. So even if you are working with someone or a community or a group that does not necessarily say, I am religious or I go to a church, I think it's important to understand how the church influences the culture. So even if I don't go to church, my grandma may go to church, right? My grandma may have a church, and if I was raised in that family, then those, even if I don't self-identify, those values and stuff may still persist. I think it's important to note that when African Americans seek help from their pastors first, they are less likely to seek help from other sources. So there are two trains of thoughts that we don't really know which one it is. So A, they may get all that they need from their pastor, and I hope that's the case. B, their pastor may deter them from seeking help outside the church. I hope that's not the case, but I will say it happens a lot. And so our work now, particularly for me, is about how do we get connections with pastors? And I think for you all who are looking to do work in this area with community groups, with religious faith communities, I cannot stress enough what it means to connect with and build rapport with pastors. I also cannot stress enough that it's not always easy work, and it may take time, and it may take real investment on your part, and you may not see the fruits of your labor immediately, but to stick with it. And so we can talk a little bit more about in the dialogue session about like some things that I've done, some strategies that I found, or questions you may have about building that rapport. But for me, I found they are the single biggest key to getting people to see mental health as important, to reduce the stigma. And when they are on board, communities tend to get on board. So that's just important. Pastors have traditionally been the ones who have kind of been the counselors in communities. And so dealing with a wide range of issues. Whenever I've talked to pastors, they've done, marriage issues, anything from marriage issues to someone dealing with severe schizophrenia. And most of the pastors I've talked to have been able to recognize when something is outside of their wheelhouse. The issue is kind of getting those connecting dots. So they recognize that this is beyond my scope of training. Maybe this person is hallucinating. Maybe this person is having delusions. I need to get them some help. But then where do I get them help? How do I connect them? Is there someone that can kind of serve as a liaison that would be a person that could get them help? And so for you all who are either working with the faith communities or who are in the faith communities, think about, is there a stakeholder within that church, within that faith community that can kind of be that liaison? Or are you that liaison? And what does that mean? And how can you make those connections? There's a lot of conversation about young adults and how young adults either identify or don't identify with church. And a lot of my research, there's still this connection, maybe not to the building, the institution, but definitely to the values. And then there's still the stigma, the learned stigma or the learned apprehension that exists as a part of that. And so don't discount or don't assume just because someone is a young adult that they don't have any stigma about seeking help. I think I've seen a lot of more conversation about mental health on social media and stuff. And so that's been really exciting. But don't just assume that someone doesn't have some kind of preconceived notions. I did want to talk about this idea of negative and positive religious coping, because for mental health, spirituality and religion can be a protective factor. We know a lot of times that people who practice their spirituality consistently, who are connected to their spirituality, have less symptomology of mental health symptoms, right? But we found that sometimes it also doesn't work. And so part of that figuring out when it doesn't work is this idea of what is negative religious coping and what is positive religious coping. And then and this is what it's called like the literature and the assessments, but one of my mentors encouraged me to think about it in form of adaptive and maladaptive. So adaptive religious coping would be someone who says, I'm going through this really bad experience. I want to know what I can learn from it, how I maybe connect closer to my higher power, my deity, my God, whatever they call it. I want to know what I can do to work with God in getting this resolved. Negative religious coping is something happens to someone and they say, well, it was because in 5th grade I skipped school and this is my punishment. And I know it sounds really like mundane, and I hope like I'm not being facetious, but it's like this was a punishment for something that I did. I see it a lot with women who may have had an abortion at an earlier point in life, and then they have a miscarriage later in life, and they may say, well, this is a result of what I did back then. And so that's not helpful coping, right? The other kind of maladaptive coping is when people put all the responsibility on a higher power, so that there's no co-laboring, I grew up in church, so this scripture always comes to mind, like faith without works is dead. And so to have both faith and works, to say like, yeah, I can go see a counselor and I can pray and I can do this. Maladaptive religious coping would say, I'm going to just kind of defer all of that to being God's responsibility. In particular, spiritual bypass is a term that we've coined that talks about people avoiding confronting emotional pain by only doing kind of spiritual practices. And I say it in quotations, not to dismiss, but it's like when you're doing all the right things, but you are not connected. And so there may be people who you find in the communities that you're working with who seem to be doing all the right things, but there's a lot of repression. There's a lot of inability or unwillingness to talk about trauma. We may not even acknowledge the like elephant in the room that's going on in the church community. We don't talk about that thing that happened 5 years ago. And so being really mindful of taking a step back and making sure that people are really doing the work and that we're doing the work ourselves, right? So if you're in there working with people, that you aren't just doing all the right things, but that you're really being mindful, you're really being reflective, you're really kind of being in touch with your own spirituality. So what are some recommendations? One of the things I always ask people is like, for your community group, and I'll go about 5 more minutes and then I'll do questions. What messages, either explicit, and here's the more important one, implicit, do people receive about mental health? Are you talking about it? Are you not talking about it? Do you think they feel comfortable? And then what messages would you like them to receive? And then how do you think you can communicate that, both in word and deed? And so most of the time people get their message from implicit. So if you are creating a brochure and you have diabetes in big print, you have heart disease, we care about your heart, and then like in the bottom corner, you have like one sentence about make sure you take care of your mental health, right? What message do you think that might be communicating to people? And you might be very well intentioned, but just think about kind of what you're doing. If I had more time, I would show this. I think this is always, I show this in most presentations I go to. This was a conversation I did with the pastor, probably one of the most effective things I've done. So if you can find a pastor who will be willing to talk, and we've kind of talked about mental health from, and I'll see if we have some time at the end, I'll play it at the end so I can make sure we get questions in. But we talked about mental health from both of our perspectives so that people could see both a mental health professional and a spiritual leader in the same space, kind of giving the same message, but from our different lenses. So they didn't feel like they have to choose. And so I would encourage you to find creative ways where people can see you and the pastor in the same space, giving the same message, being on the same accord, okay? Also kind of touting the message of prevention. So this is a metaphor I always use. We don't wait till our cars blow up to get an oil change, but we shouldn't, right? We get an oil change to prevent them from blowing up. And so as you think about your mental health, you think about the messages that you're going to send to the communities that you're going to work with. How do we think about prevention, right? So how do we get people going to counseling even when something is not necessarily all the way wrong, right? How do we think about getting people to do yoga, to do meditation, to understand what all those things are? Because that's a huge part of it. What cultural kind of practices can we use from their own framework, their own lens, that will be helpful to them? Dispelling myths about counseling. I've never had anybody lay on the couch in my sessions. So I think we have these images, what we see on TV, and that's not always correct. And so getting someone in there who can kind of really talk about what counseling is, what it is not, can be really helpful. Watching the language that you use, if you're going to be doing presentations, if you're going to be doing collaborations, being mindful of the language that people may use. So someone probably won't say like, I think I have depression, or I think I have anxiety. What they may say, particularly from faith communities, is I'm going through, or there's this trial I'm facing, or last week the devil really had me down. So you have to be mindful that they may not put these labels on them, but to be able to listen to what they are really saying. And then providing some psychoeducation on, well, you know, like when you can't sleep and when you're kind of, your stomach is queasy, your hands are sweating, that's like anxiety. And here's how we can work with that, right? Working to decrease stigma, making it okay to talk about our emotions, watching the language that we use. So one of the things I thought about, so when someone put, you know, OCD in the box, OCD is a mental health diagnosis. But how often do we hear people say, I'm OCD, because they like to clean, right? They like things clean around them. That is not OCD. And so being really mindful of how we project, what messages we project just by the language that we use. Not using like, oh, crazy or something wrong with them or something like that. Seeking to understand rather than blame or minimize, and then really providing opportunities. And the National Alliance for Mental Illness has a stigma-free campaign. There's a lot of literature that you can use. Also, SAMHSA has a lot of free literature publications that you can request to order that's already like made up spreadsheets of things, infographics, so that you don't have to recreate the wheel. And then as we close and then get ready to open up the questions, I'm always mindful of you doing the work that you're doing. So particularly as you think about in this time, a lot of you are working in nonprofits, you're working in mental health agencies, you're working in faith communities, and people are dependent on you. But you're still a human being, you're still a person. And so you cannot drink from an empty cup. And so you have to be really intentional about what you're doing to fill yourself up and how you're going to be good to yourself first so that you can also be good and be available to other people. And so I really invite you to take this time in particular to think about, how are you feeling? How are you managing everything? You know, for me, I was thinking the other day about just, I had to let go of this idea that I was going to be like this super worker and super daycare homeschool person. And I'm like, we just going to do like, we're going to embrace play over here. And I'm not going to make myself feel like I have to fill up my day with Zoom meetings. And so I know that's coming from a very privileged place as well, because I can work from home. And so I acknowledge that privilege. But like for people who are still working, who still have families, just really trying to be mindful of what you can do for you. If you can't talk on the phone all day right now, right? You need some space to kind of collect yourself. Just setting boundaries around that. Making sure you at least have 10 minutes where you unwind or you relax or you do your own meditation or your own devotional or whatever that is, making sure that you fill yourself up, I think is really, really important. Limiting the intake. I know we have to be informed, but really being intentional about when we intake information, when we intake the news, and how we kind of digest all of that. So I ran through that really, really quickly. These are more for counselors, but I wanted to make sure we had time to answer questions.
Well, thank you so much. I learn so much every time I hear you speak. And so I
was like,
I am
so bored of it by now.
No, I love it. I love it. So I really appreciated that. And I took notes of some of the questions that people have asked so far. So we'll start with those and then we'll open it up for people who want to unmute and ask questions. So to start with, this is kind of two people's questions and I'm going to put it into one, but the original question was, how do you kind of change people's perceptions and help them to take control over their mental health? So how do you make mental health like a compelling topic for communities to empower them? And then someone kind of posed a question to the original question asker saying, yes, that is really important, but how do you also balance that with the healthcare inequities and disparities that need to be addressed? So kind of like individual, but also the systemic issues.
So let me start with the first one about how to make it compelling. I think one of the things you have to do is to, because people have this idea that mental health does not impact them personally. They may say, oh, I had a cousin who struggled with addiction, or I know someone who was schizophrenic. That's their idea of mental health. But really informing people about how mental health shows up in your everyday life, how it affects even the things that we find like our heart, like heart disease, connecting it to our physical health, and this idea of that we all have mental health, that it's not an either or. And the idea about control, I don't know whether it's necessarily control, but we can kind of parallel it to, so there are some physical illnesses that are genetic to us, that are biological, that we cannot control. So similarly, there will be some mental illnesses that will be genetic or will kind of be with us, but there are things that we can do either to help minimize the symptomology or preventive measures that we can do to try not for it to be as bad or if it's symptomatic. And so I think equipping people with knowledge is always a really, really good way to do that. And I invite people to think about it as, you need a mental health expert, right? But you also need someone that communities trust. And so that needs to be like your buddy. And that needs to be the person that you can do these presentations with, that can help you with these, that can almost be a face with you, so that people will have that buy-in. And then there was another part to your question about, what was the last one? I'm sorry.
It's more about how that's shaped by like broader inequities and systems.
Yeah, I don't think you can separate the two. So I don't think there is a broader system inequity or mental health. I think they very much all kind of go together, which can make it really messy. But I think that's why it's important to have mental health as a part of this conversation, so that people see, like, it's not just that African Americans experience homicide rates at 2 times the rate of other population groups. That means there are both more people who are grieving. That means more people have been exposed to violence. What do people do with that trauma? How does that trauma manifest? So maybe it's not a coincidence that this 15-year-old saw his best friend die on the street, and then he dropped out of high school, right? So maybe we need to kind of put those conversations together and not let it be separate kind of conversations. What does it mean that people are experiencing poverty at higher rates, and how does that affect someone's emotions and their abilities to kind of maneuver and manage life a little bit differently? And to not forget, and this is what I always try to remember too, or I try to say, to think about the resilience of that, right? That it's not like a doom and gloom kind of conversation. Systemic inequities, disparities exist. And people have persisted, people have continued. And so what are some of the strengths that we find in these communities? I always think about Yoso's community cultural wealth, and it talks about the capital that exists, the navigational capital. So there are just some things. So I grew up middle class. My husband grew up, and he would say he grew up poor, right? And there are some things he can navigate, he can figure out. His brain works differently because he's had to. And so I think identifying some of those cultural strengths can be very important as well, to not always focus on the negative, but how do we take those strengths? How do we hone on those? How do we use those to help build our mental health?
Thank you. And I'm going to kind of flip back to a question that came a little bit later in the chat, because I think it's related to what you're just saying. So what responsibilities then do religious leaders and clergy have to guide people who might be experiencing mental illness, to guiding them to a trained counselor to address these unaddressed childhood traumas, instead of just kind of addressing things piecemeal or ways that they might through pastoral care traditionally?
I think they have a huge responsibility. And I put a lot of onus on them, because I think they had the rapport, I think they had the power, and with power comes responsibility. And so I think for them, it is really identifying where their roles are, where their strengths are, where their abilities are, where their trainings are, and then connecting people to resources outside their training. So there are some things that you can go to your pastor for. I don't think necessarily you have to go to a counselor for, but I do think the pastors need to be informed as much as they can on their own mental health, because that's a lot of the issue, right? And then two, how they connect people, how what messages they send from across the pulpit. So a lot of times my conversations with pastors is not like one-on-one. They're like, yeah, I'm behind you. And then I'll visit their church, or I hear them speak, and they'll say something like, that was not, a message of promoting mental health right there. And so really kind of putting a mirror up to them as well about some of the messages and some of the ideas that they perpetuate in their sermons and stuff.
And just to kind of respond, Shannon had a comment about this, saying as a pastor, they were taught in seminary to refer, which is great. Yay, pastoral care. When a person came into with something outside of the area, and they've done that, but often what they see is frequently someone with mental illness unable or unwilling to even begin the conversation, which causes disruption to that person and to the congregation. Mm-hmm. So
yeah, I think that is a huge area, why I think that this work is continual, because people have to feel like they can trust like the referral. They feel like they can trust the referral source. And so counselors, visit the churches in your communities. Mental health professionals visit the churches in your communities, so that the pastors will be able to put a face to you, and you'll be trusted, and you'll be visible in the community as much as possible. And then in those situations, I do say, like, if the pastor has to take the person to the mental health agency, or just really say like, this is somewhere you really, really need to go. And I think what's important is that about that comment is that there was, she talked about in seminary, she had that training. And so that person is much further ahead than someone who didn't have any training at all. And so, doing what you can until you can get that person to refer to someone else.
And so related to this, there's a question about kind of for those who are not clergy, but who work with communities and are trying to be good listeners, how do you distinguish between someone who's experiencing minor stress and someone who really does need professional help?
I think it's about how it's interrupting their functioning. And so I always err on the side of, particularly for those who may not be mental health professionals, to just connect them with someone. It never hurts to just, even if you have to go to one session or, you need to be triaged. But if you see that a person's work life is being interrupted, their relationships are being impacted, that's a huge red flag to me that something's going on and that it's really impacting their ability. If you think about that definition, to be a good contributor to their community, to have healthy relationships, to work, those type of things.
So a question a little bit separate from these, which have been really great, is, how, so it was a comment about someone who hasn't been stressed at all until just recently, now working from home, having to justify what you're doing all day long, also feeling the kind of anxieties. Like, how do you as a counselor, what advice do you have for people who are trying to navigate these hard waters right now?
I think, first of all, to acknowledge that this is hard. This is new. None of us have the answers. And so in some ways, we're all kind of navigating, I keep saying, like, uncharted territory together. And so acknowledging that you don't have to have all the answers and that it is hard is I think, the first step. And then going back to some of those things I said before, being mindful of how you're intaking information. What expectations do you have upon yourself? So I don't have a degree in early childhood education. So I was expecting myself to be like this amazing daycare teacher when I don't have the tools for that. So I'm like, get real, Janeé. Like, let her watch TV or whatever. I mean, that's probably not what y'all want to do, but that was what I need to do at that point because I don't have those tools. And so don't put expectations on yourself that are outside of kind of reasonable. And I'm trying to be really mindful of when I watch the news and also like, you want to Netflix and binge, okay, but what shows are you watching? Are they helping you? Are they not helping you? Staying connected to your community and your loved ones. So we a couple of my friends were doing like this Netflix party watch thing. And then I'm making sure I FaceTime with my parents, making sure my parents FaceTime with my daughter. So social distancing doesn't have to be like emotional distancing. And I was even trying to think about ways that my husband and I could like do a date night. Because I'm like, we're just existing at this point. So how do we make sure, like, let's watch a movie tonight or something? And then I've been really reflecting on this. I've been thinking about teachers who have to prove they are working all day long. I'm like, they are working so much more. And so I think just being reasonable in what you're doing, doing the responsibilities that you're doing, that you're expected to do, but not putting unfair expectations on yourself. So in this season, I have like let go of the fact that I'm going to be this extraordinary research and writer right now. And it really is about, can I keep my classes afloat and make sure my students have what they need? So I hope that was helpful.
I think so. Yeah. So at this point, we've gone through all of the questions in the chat. If someone would like to unmute and ask a question, now is the time to do that. We've got about 13 minutes left, 12 minutes left. All right. It looks like Elle Spritch, I can't tell who that is, has a question, so go for it.
Hi, Janeé. Thank you so much. That was so helpful. I did ask the first question about empowering churches. So I work in a primarily Black Baptist church, and we're doing the Faithful Families program there, and just I wish that they could just I mean, there's a lot of chronic disease, a lot of like typical statistics like you said that are more frequent in Black churches. So, and I want them to kind of take ownership and not be so passive about, because I don't want to come in and direct them. I want them to be able to say what's important to them and what they want. And I'm sure that that's just kind of more of a long-term thing, but how do I get them to do that?
Yeah, well, one of the things
Really take ownership of what they want and how they want it to be, and help them get there.
So one of the things I think about, and this is like when we do research with churches, is to get them to really identify what they want things to look like. And so it's like in 10 years, in 5 years, in a year, what do you want your church, your community to look like? Kind of start there with a vision. Then thinking about what strengths, what tools, what resources already exist that they may not even identify as resources, or they may not identify as strengths, but helping them think through that. And then coupling that with, okay, here's what's happening, here's what you have. So for example, like a lot of times people don't have a mental health ministry, but they have a health ministry, right? So that's a resource, it's a strength that already exists. And then how then do you as a community worker, you as a community agency come in and just build upon what they already have and what works for them? Because what happens is kind of like when we write treatment plans for clients. If I write a treatment plan, I say, go journal for 30 minutes every day, and the person's not a journaler, like that's not going to be effective. So I say, what works for you? How do you get your thoughts out? And so also maybe using language to connect with them that's less clinical, that's less jargony, and just saying like, what do you want for your children? What do you want for your church in 10 years? How do you want this community to look? What do you want it to be? What does health mean to you? Right? And so kind of getting some of their ideas about that, and then using that to build resources and community power. And then find out who your stakeholders are. Always find out who has the power. So your pastor is a powerful person, right? But there's probably somebody in that Baptist church on the deacon board, on the mother board, who really wields a lot of the decision making. And so really finding that person and connecting with them and building relationships with them and using them as a voice as well.
Thank you. That's helpful.
Does anyone else have a question that you'd like to ask? You're welcome to just unmute yourself and ask a question.
Hi, my name is Zakiah Stewart. I'm a nutrition educator out of Middlesex County in Union County, New Jersey, and I work with one faith-based organization in my hometown, and I wanted to know if you're able to share any mental health resources that might be available to faith-based organizations and the leaders within these faith-based organizations, because I feel like a lot of times resources might be passed on to congregants and people of the church, but a lot of the times those resources aren't necessarily utilized by the leaders within the church or the faith-based organizations.
Yes. So the National Alliance on Mental Illness has a whole section on like spirituality resources, where it has some kind of like pamphlets, literature you could pass out during Sunday services, different prayers that you can pray about mental health. So that's one that's really good. And then SAMHSA, as I was referencing earlier, has a lot of like just publications on like basic, what is mental health, what is depression, that even you as a community agency can order and just give it to them if they want to sit it outside, so people can pick up one when they leave. But I would start with the National Alliance on Mental Illness, their spirituality section. I will say that the United Methodist Church tends to put a lot of funding and support and resources in mental health, and so sometimes a lot of that literature is very United Methodist kind of from that framework, and so maybe finding one that fits the culture or the perspective of your church. You may have to do a little bit more digging, but that is a great place to start.
Thank you so much.
Mhm.
And just a quick note that some of those resources we have included in today's newsletter. So if you scroll down to the resources section under today's Faithful Families newsletter, you will see several of those there. All right, here's a question from Victoria. Even though you discuss the importance of recognizing mental health with the communities we work with, I appreciate you also stress that individually our mental health is just important. Listening to you has already decreased my stress. Can we have a webinar with you every day? Thanks so much for speaking.
Well, I'm glad. So I was able to get my 3-year-old to not be disrupting us for this 1 hour. I could not guarantee that would happen every day. So but yeah, I'm glad. And I just really think it's important that we take care of ourselves. We're not good to anybody else if we aren't good to ourselves first. So
this webinar is being recorded, so you can listen to it every day if you needed to. I'll ask a question related to that. So what things are kind of filling you up these days, if that's not too personal, but like, yeah, I was reflecting as you were talking about, the things that we're watching on Netflix or the things that we're consuming that you think are helping, but that are not. And so are there things that you found that are like helping you feel good right now?
it's very interesting. It's been harder to find those things.
Mm-hmm.
And like I said, I wasn't feeling good for a while, so I was like, I wasn't able to go outside as much. So trying to go outside. Me and my friends, we have a group chat. I have a couple of group chats, so group chats feel me. One of the group chats is with a lifelong group of my friends. We've been friends literally since like 6th grade, and we started doing this random fact day. So each person has a day, and we send random facts about ourselves. So it's been very funny, very interesting to read the random facts about each other. So finding like little spots like that in my day. Like I said, I'm trying to think about how like my husband and I can have like a date night. So for me, it's about connecting with people. I'm a very relational person, so I need kind of those relational moments to feel me. So I'm trying to be really intentional about that. And I'm not putting a lot of pressure on myself to be superwoman in this season. I think that has helped me more than anything. That I'm just human.
Mm-hmm. Well, I think we probably have time for one more question if someone has a burning question they'd like to ask before we end. You're welcome to just unmute and ask your question. Okay, well, hearing no other questions, I would just want to say thank you so much, Janeé, for this incredible work, for the work that you do. Google Janeé Avent-Harris. You can find her Google Scholar page. She has published prolifically. And if you are looking for inspiring things to read during this time, check out some of her articles. But we are so grateful for you spending this time with us and for being a part of the Faithful Families Virtual Summit. And thank you to everyone who attended today. I hope that you got as much out of it as I did. We're just really grateful for all of you and being able to connect, like you said, during these times. It's really important. So
Thank you all, and take good care of yourselves.
take care.